Good afternoon, everyone. I am Chris Mendoza, a pharmacist and owner of Prairie Health Apothecary. On behalf of our team, I want to welcome and thank you for being here today. As a pharmacist who has been in community practice for the last 17 years, I always believed that a pharmacy could be so much more than just a place where you go when you're not feeling well, but rather a community hub where people come to connect about their health and wellness. So with all of you being here today, this supports this vision. Many aspects of pharmacy have changed since I graduated, but pharmacists' commitment to caring for the health of our communities remains unchanged. The COVID pandemic has highlighted this commitment and has shown the resilience of pharmacists. It has been business as usual. Our pharmacies have not closed as we are not able to work from home. For a majority of the pandemic, pharmacists were the only healthcare professionals that patients could connect with face-to-face to discuss their concerns, alleviate their fears, and be a trusted and reliable source of information. We provided flu shots during the pandemic, and most recently, COVID vaccines, all while continuing our regular duties to make sure our patients stay healthy. Now that's uber multitasking. Community pharmacists were an integral part of the initial vaccine rollout to help the general population get to our current vaccination rates, and we will continue this as booster doses are required. I am so proud to be a community pharmacist, and I am honored to be able to provide this level of care to my patients. We've all just had to adjust and pivot, and I am very excited to see what we can do next. With that in mind, I am incredibly excited that Minister Gordon is here today, along with our other guests, for an important announcement affecting my colleagues across the province. Now I'd like to turn things over to Manitoba Families Minister Rochelle Squires, who will be emceeing this announcement.
Thank you very much, Ms. Mendoza, for being here today, and I'm delighted to be in my constituency of Riel to support an important announcement for Manitobans as we continue to respond to COVID-19 together. Today, our speakers include my colleague in the Legislature, Minister for Health and Seniors Care, Audrey Gordon, as well as Ashley Hart, the President of Pharmacists Manitoba. Thank you for being here today. And of course, I also want to acknowledge my colleague from the Legislature, Ms. Janice Morley-Lecomte, who is joining us for this announcement. And after the formal announcement, we will be available, all of the speakers will be available for one-on-one interviews if required. And with that, I'm going to ask my friend and colleague, Ms. Audrey Gordon, to come forward and make the announcement.
Thank you all for being here today, and thank you to my colleague, Minister Rochelle Squires, for the introduction. As she mentioned, I'm Minister Audrey Gordon, the Minister of Health and Seniors Care, as well as the Minister of Mental Health, Wellness and Recovery, and I'm happy to be here at Prairie Health Apothecary to make this announcement. I would like to extend thanks to Ashley Hart. We met a few weeks ago at the Nine Circles announcement there with Doctors Manitoba as well. Pharmacists Manitoba for being here, and Ms. Chris Mendoza, pharmacist and owner of this facility, for hosting the event. Today, I'm pleased to announce that the Manitoba government has taken steps to enable pharmacists to perform COVID-19 rapid tests for people traveling outside of the province. This change builds testing capacity throughout the province, bringing COVID-19 testing to the neighborhood level, and provides travelers with more choices. Rapid test requirements, as you know, vary by country, so individuals should confirm which type of test is required when making their travel plans, and of course, before taking a rapid test. People will be able to request a test by showing their pharmacist documentation related to their travel plans. Fees will be set by each pharmacy providing the service. Pharmacies will acquire their own rapid test supplies, train their own staff, and advertise the service at their sites. This change allows Manitobans to access both rapid antigen tests and rapid molecular non-PCR tests at their local pharmacy. This is an exciting announcement that provides Manitobans more choices for COVID-19 rapid tests and the ability to go to their local pharmacy to get their test results in a short enough time to meet travel requirements. Thank you to Manitoba's pharmacists, all of them, for their positive contributions, and thank you to all those who are continuing to take appropriate measures to protect Manitobans.
Thank you very much, Minister Gordon, for those comments and for that welcome announcement. Now I'd like to ask Ashley Hart to provide some remarks on behalf of Pharmacists Manitoba.
Good afternoon, everyone. My name is Ashley Hart, and I am president of Pharmacists Manitoba. We are pleased to be part of this announcement today authorizing pharmacists the ability to administer and interpret rapid testing for COVID-19 related to travel. Thank you to Minister Gordon and her office for consulting us and working collaboratively on this initiative. Throughout the pandemic, pharmacists have consistently looked for new and innovative ways to serve their patients and provide accessible and reliable health services and information. We are pleased that we are now able to offer rapid testing similar to that of other provinces across the country. Rapid testing in pharmacies is another small step towards bringing Manitoba in line with the advanced pharmacy practices seen in other provinces across Canada. We look forward to providing Manitobans access to convenient rapid testing services, and participating pharmacies will be working hard in the coming days and weeks to make this available in communities across the province. We ask that individuals verify the testing requirements of the country they are traveling to prior to requesting a test, and that proof of travel is presented at the pharmacy as outlined in the orders. As the most accessible healthcare providers, pharmacists look forward to again playing a significant role in helping Manitobans resume normal activities, including travel. Thank you.
Thank you very much for being part of today's announcement, and thank you so much for all the work that you and all your pharmacies do for Manitobans, especially as we're moving throughout this difficult, challenging time. And I appreciate the commitment from the Pharmacists Manitoba. We will now open up to the media for any questions. All of our speakers are available to answer any question.
Great. If we can just keep these questions to this announcement only, and then we'll break for a picture, and then come back and answer other questions. So this announcement only, go ahead.
Fees. One of the complaints that we've heard a lot is just how expensive it currently has cost to get a test. Do you have any sense of what the fees are?
Well, we have to remember that this service is being offered in provinces across the country and in pharmacies in those jurisdictions. So I anticipate it would be somewhat on par with that, but we do have to keep in mind that each pharmacy will set the fee.
Is there any subsidy? Is the province subsidizing the cost of these rapid tests?
So pharmacies will be required to acquire the tests and to train their staff, administer the test, interpret, and levy the fee that's specific to their site.
So there's no subsidy?
Not at this time.
How much does the test cost? Generally speaking, for province to administer a test or provide a test before it goes to a pharmacy.
I don't have that exact figure, but I can get it for you at later today. So, do you know what the tests are? I haven't needed one.
How much does a test cost? Like before it gets to the pharmacy and they decide how much they're going to charge?
Yeah, I don't have that information off the top of my head either, and there are different tests, that different types of tests as well. So it will depend on the supplier and different factors.
Excuse my absolute lack of knowledge on the flow through of this, but from what I heard, the pharmacist will do the test and then do the assessment, so it will not have to be triaged to a central location for verification before coming back. Is that correct?
That's correct. These are all rapid tests that can be completed in the pharmacy, and then the interpretation will be done by the pharmacist as well, and documentation will be provided to the patient.
So you just come in, and it's literally the amount of time to take the test and do the evaluation, and then you're gone.
keeping in mind that we are doing the regular workflow in the pharmacy as well, and there you may have to wait in line and also wait for the completion of the test.
Is the documents that are provided to the person who's being tested, are they, I guess, a government document?
Not at this time, and we would have to follow whatever the jurisdiction that the person is traveling to, whatever they require for documentation.
The province has been using two specific rapid tests. Is it going to be the same rapid tests that the province has been using for healthcare workers, education workers, or are there going to be other tests, other types of branded tests that places like this would be using?
There will likely be other types of brands and so forth, all obviously approved by Health Canada, but it will depend on where the pharmacy chooses to order from, like what the supplier is.
Is the provincial government considering offering PCR testing for travel purposes, for asymptomatic purposes at any point?
I think there are a couple of private labs that offer that, but at this time we are expanding the scope for the pharmacies for the rapid antigen tests only.
What about, so the cost of the PCR test, if you get it privately in Manitoba, it can be upwards of $200. Is there any thought to bring that cost down for Manitobans who need that test for travel?
Well, that cost is determined by the lab, and in terms of the test that is being offered. We're always in discussions with Health Canada, with our federal counterparts about testing. As you know, the border will open on November 8th, and so a lot of individuals are looking at their options in terms of testing, and we want to broaden their ability to get tests closer to home.
Testing is held out as an alternative to getting vaccinated, and there's looming deadlines with respect to civil service. Are you confident that you're in a position to offer massive testing to a significant cohort coming up? Do you have that capacity within the system?
So our team is very confident that we will be able to offer testing across the province to healthcare workers and other frontline personnel. We have been planning for weeks now. So not just today being the deadline, we've been planning for weeks. We have been shipping tests out to the various regions, and we are ready to go. And we actually started some testing today.
And do you have a target in mind for, I apologize if I should have known that. Is it a couple of tests a week, or?
Well, as the public health order states, it depends on your shift, and your results will only be valid for a certain time period, and if you have further shifts that week, you may need to be tested up to 3 times a week.
Are there any other questions on this announcement specifically?
Yeah, for this, when is this going into effect for pharmacies being able to sell these rapid tests? Is this effective immediately? I didn't see a date on the press release at all.
So I've signed the health order. It is effective today, and it will be up to each pharmacy to source their supplies, advertise at their site, and begin offering the service. But we've enabled it to begin today.
Prior to this, have they been able to acquire these tests to have a stockpile ready to go in anticipation of this announcement, or have they had to wait until this announcement to get that? So if somebody today wants to go get a test, are they able to get a test today, or are they going to have to wait for that stockpile is approved?
Well, I know that some pharmacies, we have been consulting with the pharmacies and the association, so some may have, in anticipation of today's announcement, gone out and purchased some. It's hard to say. I would suggest that Manitobans call around to their local pharmacy to find out whether they have the test available. But as Ashley stated, it should be imminent, any time now, that they have them available.
And you alluded to a border opening. You alluded to a border opening on November 8th. The test that the pharmacies will offer the primary exit return for Manitobans would be the United States. These tests will satisfy those travel orders, correct?
As I understand it, will satisfy outbound travelers. Inbound travelers to Canada still require the PCR test, and that is a federal government Health Canada decision.